my friend Marilyn, and I'm so excited that she's going to get to share with you today. Marilyn is a dentist, and she is currently not practicing in Corpus Christi. She is taking care of her very, very, very cute 1-year-old. But she is going to start doing some limited practice here in Corpus, and I think she's going to talk about what she'll be doing there. But she's going to talk to us about oral health beyond brushing and flossing. And so yeah, everyone give your attention up for Marilyn.
Thank you. I am really excited to be presenting to you guys today. So I know that you guys were able to get a break in between Dr. Leverance and Dr. Scott, and we're just going to be jumping right into this. But let's go ahead. Everybody can stand up, kind of twist around. If anyone has any soothing oils they want to spray around and we'll all feel happy, we can do that too. Take a minute. If anyone needs to go get a drink of water. I know I am really excited to hear the pediatricians talk, so I will try to keep this brief so we can get through everything that's important, and we can hear some of her presentation as well. I'm smelling. I don't think I'm smelling anything. I know I saw some people with some orange deliciousness back there. Feel free to spray some oils around. All right. So I'll go ahead and get started. Feel free to grab some water, take a break, going in and out. Today I'm going to be speaking about oral health beyond brushing and flossing. So I know when people think of a speech that a dentist might give, I might just yell at you for not flossing your teeth and brushing. And I'm not going to do that today because, well, you'll hear in a little bit why. So my name is Marilyn Brodeur. I just want to give you a little bit of background about myself. So I graduated from University of Maryland Dental School in Baltimore, Maryland. That's where I moved from before coming to Corpus Christi. After I graduated, I went 2 miles down the road and I was a dental resident at Johns Hopkins Hospital. And I worked there for a year treating a lot of very sick patients, but also a lot of very healthy patients and just taking care of their regular dental needs. And after I was finished with my residency at Hopkins, I went back 2 miles down the road to University of Maryland, and I was a faculty member there for 2 years before moving to Corpus Christi. Now, as Katie said, if you would like me to be your dentist, you're out of luck. I'm not practicing right now. I'm hanging out with this little guy. This is my 1-year-old Gabriel. He just turned 15 months, and he has 7 teeth, and I'm so proud of that. And his 8th is coming in right now. So that's a little bit about us. I'm actually surprised I was able to get that picture because he's moving all over the place. He's a little bit vain, though. I discovered that if you take a selfie where they can see the camera and they can see themselves, he'll just stay really still because he's a bit vain. All right, so that's me. Okay, oral health beyond brushing and flossing. I have a confession to make about brushing. So this is me at probably 10 years old. I'm in the center. I have the red shirt on. I'm the oldest of 5 kids, so I'm your typical type A, oldest child, go-getter type, and I feel like I was actually a really fantastic oldest sister. I feel a little bit like Oprah here with this microphone. I might wander up the aisles if I so desire. So I feel like I was a really great oldest child. I was really helpful. I was nice to my brothers and sisters. I would help my parents. And, this is a future dentist you're looking at right here, So when I would go to the dentist, my dentist would say, "Marilyn, were you brushing your teeth?" And I would say, "Yes." And I was lying. I did not brush my teeth as a child. I brushed really hard right before I went to the dentist. But I was terrible at oral hygiene. I just wasn't so into it. However, do you know how many cavities I've gotten in my entire life? 2. I've had 2 cavities in my entire life. Now, I tell you this story not to give you permission to stop brushing and flossing your teeth. That is not what I'm saying. Brushing and flossing are actually very important for your oral health. However, they are not the only factors that can contribute to oral health or not. And so I'm hoping that we'll dive into this as we go. So let's go ahead and talk about basic dental diseases. Kateri, this is your cue. So even though I'm not practicing right now, a lot of dental companies still send me stuff. So I got a huge box of travel size Listerine bottles. I've got like 50 of them. I'm not going to use all of them. So I'm going to give some of them out to you today if you answer some of my questions. And Kateri will give them to you. All right, my question for you is, there's two answers I'm looking for. What are the two most common oral diseases? Gingivitis. Oh, wow, you guys are really tripping me up here. I thought you were going to say something else. Okay, gingivitis is one of them. Periodontal disease and what else? Plaque. That's not technically a disease. Halitosis, no. Wow, I'm really surprised. I mentioned this previously in my story about my childhood. I was a terrible brusher. Cavities. The technical term for it is dental caries. And this is what dental caries looks like. We'll talk a little bit more about that. The other common oral disease is periodontal disease, or sometimes it's referred to a portion of periodontal disease, a subset of its gingivitis, which was mentioned. And that is what periodontal disease looks like, and we'll get into that a little bit more. So this is an up-close view of a tooth which is undergoing dental caries. Caries is, I believe it's a Latin word for decay. So you can see the decay starting in this portion of the tooth, and it slowly starts to go inward. Why do dentists always take x-rays? Because sometimes you can't visualize that just looking down at a tooth. So we take an x-ray so we can visualize what the decay looks like. Now, dental caries is fairly common. The blue bar represents people who have active tooth decay in their mouth. It was done in a CDC study from 2005 to 2008. So on average, about 20% of the population has some sort of active dental decay. The green bar represents a dental restoration or a filling. So this is what percentage of the population has a filling. And as people get older, they tend to at least have one filling in their mouth. The other dental disease is periodontal disease. Peri means around, odont means tooth. So this is referring to disease that is around the tooth or your gums. And it's actually not just gums. I was really surprised to learn this in dental school. It also refers to bone. So on this x-ray right here, the white that's around the teeth, that is bone that holds your teeth in your mouth. And as periodontal disease progresses, the bone is slowly recedes and is eaten away, and it goes from looking like this, which is a very healthy periodontium, to looking like this, where the teeth become loose and they can fall out. And periodontal disease is very interesting because it's a condition where you don't realize it's happening. It is not painful, but it's a slow process that happens over years. And the prevalence of periodontal disease, people over 30 in the United States, about 50% of people have periodontal disease. So in this room, if we split it right down the middle, about 50% of you have some development of periodontal disease. All right. What causes oral breakdown for some listeners? And Kateri, you can just start handing some of this out to people who are answering my question. What causes these oral diseases? What is the root source? Diet. Indirectly, but I'm looking for another answer. That's not the most basic root cause. Bacteria. Give this girl some Listerine. Bacteria. Very good. Exactly. This is a picture of Strep mutans. Strep mutans is the bacteria that is predominantly found in beginning dental decay. So as a dentist, when I see this, these are bacterial infections. That's what's going on in these dental diseases. Now, unfortunately, we don't have a lot of time. Again, bacterial infection. Oh, my slide got turned around. So today, I don't have a ton of time. I would love to go into periodontal disease. It's fascinating, has a lot of systemic effects, but I don't have the time to do this. Perhaps if there's another wellness summit, I can come back and tell you all about periodontal disease. But today we're going to learn more about dental caries. And before we get going on that, I just wanted to educate you guys about how bacteria interacts with our bodies. This is a TED Talk from Bonnie Bassler. She's a microbiologist at Princeton, and she gives a really great overview about how bacteria interact with our bodies. Unfortunately, we don't have good audio, so I'm going to be putting my microphone up next to the computer, and we'll see how this goes. And we can't hear her. All right, give me a second. I'm just going to increase the volume once I get started. Okay.
Organisms on the earth, they've been here for billions of years, and what they are single-cell microscopic organisms. So they're one cell, and they have the special property that they only have.
Can any of you guys hear that?
DNA. So they have very few genes and genetic information to encode all of the traits that they carry out. And the way bacteria make a living is that they consume nutrients from the environment, they grow to twice their size, they cut themselves down in the middle, and one cell becomes two, and so on and so on. So they just grow and divide and grow and divide. So kind of boring life, except that what I would argue is that you have an amazing interaction with these critters. I know you guys think of yourself as humans, and this is sort of how I think of you. And so this man is supposed to represent a generic human being, and all of the circles in that man are all of the cells that make up your body. So there's about 1 trillion human cells that make each one of us who we are and able to do all the things that we do. But you have 10 trillion bacterial cells in you or on you at any moment in your life. So 10 times more bacterial cells than human cells on a human being. And so of course it's the DNA that counts. So here's all the A, T, G's, and C's that make up your genetic code and give you all your charming characteristics. So you have about 30,000 genes. Well, it turns out you have 100 times more bacterial genes playing a role in you or on you all of your life. And so at the best, you're 10% human, or more likely about 1% human, depending on which.
Spoken like a true microbiologist, she thinks that we're mostly bacterial instead of human. So the takeaway points from that is that we are covered in bacteria. We have more bacterial cells on our bodies than we do our own human cells. There's an amazing interaction between us and the bacteria that's on our body. Okay, were you guys able to hear that at all? That was working? Okay, because I have a few more videos and I just want to make sure that we'll be able to get that. All right, bacteria, there's tons of them all over our bodies, but what's also fascinating is how they interact with each other and how they're able to live on our bodies. And they live in communities called biofilms, and this video does a really great job explaining what a biofilm is and why that's important.
More than 300 years after bacteria were first discovered and long after we came to realize that they're all around us, scientists have recently realized that microbial life, most abundant mode of life on our planet, often exists in highly complex interactive communities called biofilms. So rather than living independently as single cells, bacteria and other microorganisms like fungi and algae typically live in biofilm communities. For many microorganisms, being part of a microbial biofilm is the default mode of life. These aggregates of cells of many different types and characteristics are found on all surfaces in watery or moist environments. Members of biofilms interact in very complex ways to achieve collective function. Hence, this interactive communal lifestyle allows for a large spectrum of microbial activity. Biofilms are essential for the well-being of our.
Okay, since we're short on time, we're not going to watch much more of that video. But basically multiple species of different kinds of bacteria, they all can work together to achieve these collective functions. And some of these collective functions even happen in our mouth, like tooth decay. That is not just one type of bacteria that causes tooth decay. It's many of them all working together to infect our tooth. However, they're not only bad, there's also very good things that are happening in our mouths, but today we're just focusing on the bad stuff, so we know how to take care of it. So let's talk about oral bacteria. This is actually an electron microscope image of some oral bacteria on the tongue. And as you can see, it clearly doesn't seem like it's just the same species of bacteria. And in fact, there's been a push for something called the Human Microbiome Project. You may have heard of the Human Genome Project, where they were looking to sequence all of the DNA within human beings. Well, now we're looking to sequence all of the DNA in bacteria that live on humans, so the Human Microbiome Project. And as a subset of that project, there's a Human Oral Microbiome Project, where they're looking at all of the different types of species of oral bacteria. And this has just come out within the last few years, and it's pretty unbelievable. So 60% of this bacteria, we've never been able to cultivate it before. We've never been able to see it under a microscope outside of the oral environment because it just can't live anywhere else. So the way that we were able to figure this out is because we can sequence DNA of bacteria and figure out, wow, this is a separate species. There have been 700 different species discovered just in the mouth. They all, many of them live in biofilms. However, within an individual person, there's only 75 to 150 different bacterial species in someone's mouth. But there's 700 species that have ever been found in human mouths. So there's a wide range of diversity between person to person. And it's also been learned that some of these bacteria only live in certain places in the mouth. Like the bacteria under your tongue might be different than the bacteria that are underneath of your gums. I found this quote really telling. There's a 0.1% difference in our genomes. So 99.9% of our human DNA is exactly the same. There's only a 0.1% difference in our DNA. But there may be up to a 50% difference in our DNA, just our bacterial DNA from person to person. Okay, so to recap, we got lots of bacteria on our bodies. Tooth decay and gum disease are bacterial infections. They live in communities called biofilms. All right, now that you've had your biology lesson. Again, I'm just going to be focusing on dental caries and that process. So dental caries begins with this process called demineralization. And I'm going to throw a graph at you that is, every dental student sees this. This is how dental caries starts. So what happens is, typically when you eat foods, the bacteria in your mouth are like, yay, we get some food, and they're going to replicate and eat. And what happens is the metabolites that they produce make your mouth more acidic. And that is this, what's happening in this drop. So a pH that is a lower number means that you have lots of acid in your mouth. And once the acid level drops below 5.5, that's when the outer layer of your tooth starts to dissolve pretty much. When you're in this red zone, you are developing tooth decay. You're not developing tooth decay, you're beginning the process of developing tooth decay. So demineralization begins in enamel, and I found this really awesome video that I wish I had seen in dental school, which is a video zooming in on a microscopic level of what enamel is made up of and what it looks like. So we'll go ahead and have a listen. Can you hear this? No, not really. Okay, we're going to ditch this because I don't think we're going to be able to hear the audio, unfortunately. So I'm going to zoom in. We'll see if this works. Okay. I think I've messed up the video now, So we will just move on. I do have a recap of what you would have learned had we been able to zoom in and view this video. So enamel is formed only once. There are specialized cells that form enamel during tooth development, and they die, and those cells are never able to be brought back, so you can never reform the enamel. It's the hardest tissue in the body, and it's made up of the same structure, hydroxyapatite, which is found in both bone and dentin, and it's 96% hydroxyapatite, which makes it the hardest surface in the body. But it's only 4% water and protein. And hydroxyapatite is made up mostly of phosphate and calcium. And I want you to remember that because that is going to be important in the future. So anytime you get into this red zone, the phosphate and calcium ions or atoms is what is being dissolved off of enamel because that's mostly what it's made up of. Okay, we're going to talk next about sugar consumption. Does anyone know who this is? Who that's a picture of? It's not Marie Antoinette. That's a good guess. Queen Elizabeth. She's one of my favorite figures from history. She was a very large figure in British history. She was the daughter of King Henry VIII. And she really, the Elizabethan era, Shakespeare was huge in Britain at this time. Unfortunately, she also had very poor dental health. And part of the reason why she had poor dental health is because she loved tea with sugar. And in fact, when she was in her old age, there was an ambassador who came and described what her features were. And he said that her teeth were black and she was actually missing some teeth, and it was difficult to understand her later in life. I have a question for you. What do you think is worse for your teeth, the amount of sugar that you eat or the frequency of having sugar? Yeah, well, you guys are right. And there was this study done in Sweden that actually figured this out. It was done in a mental hospital in Sweden in the 1940s. This study would never be allowed to happen today. They would double and triple the amount of sugar that was put in the patient's food. And then in another group, they would just give them toffee snacks throughout the day. And the study, interestingly enough, was funded by the confectionery industry in Sweden. And the results didn't come out until a few years afterwards. I'm not really sure what they were, what if it shows that sugar actually does cause tooth decay? What are you going to do about that? So that was the study that definitively showed us that having a frequent amount of sugar causes tooth decay. And why is that? Because every time you eat something that has a fermentable carbohydrate, which is a sugar or something that bacteria can eat, it drops your mouth pH and drops your mouth into this red zone where your enamel is being dissolved away in your mouth. Something else that can drop that pH is actually just having acid in your mouth. The picture on the left, well, I guess on your right, that is a picture of a woman who liked to suck on lemons. And her enamel on the front of her teeth has been completely dissolved away. And then the picture on the right, this is a picture of a bulimic. So having stomach acid in your mouth, it completely dissolves away the back of your teeth. The last important part in this demineralization process is saliva. I don't know why I was looking for an image of saliva because that would actually be kind of gross, but that's actually the first picture that comes up. Saliva is a band. I learned, I don't know why they wanted to name themselves Saliva, but they did. And we're just going to go ahead and skip the video because I'm not sure if it's going to be working. Basically, your saliva is actually really interesting. There's a lot of really great immune factors and things that can keep your mouth healthy. So there's immune factors, there's calcium and phosphate, which is an enamel, digestive enzymes, and IgA antibodies that help to protect you against microbial infections. Would someone mind getting me a drink of water? Okay, so phosphates and calcium in saliva. It's also an enamel. which is great because this portion of the curve where it goes back up again, that upward motion is mostly due to the fact that you have saliva in your mouth that's able to reintroduce those phosphate and calcium ions. Okay, so we've talked about basic dental diseases, and it's kind of a downer. I mean, are we never going to eat sugar ever again? Maybe we'll never eat again. Fortunately, our teeth undergo this process called remineralization, where we can reintroduce those atoms and ions that have been leached off of and dissolved off of our enamel. Demineralization. I got kind of carried away with how it can move back and forth. I thought that was fun. So the picture this tooth, that is actually an example of a tooth that has remineralized. There was decay and it rehardened. This tooth, unfortunately, the decay continued to progress. I wasn't sure if I was going to bring this up in this topic, but I'm going to go for it. This tooth, the reason why it remineralized was because fluoride was put on that tooth. Fluoride is actually really great in remineralizing teeth. But there's other things that can be done to remineralize teeth. So I understand that there are some people uncomfortable with using fluoride. I am okay with that. There's other methods that you can use to remineralize your teeth. Okay. So in order to remineralize, you need to be up in this white zone. You need to have your pH high, and we need to have the length of time that you're in this red zone to be decreased as much as possible. And there's a couple, and I'm going to go through some tools on how you can remineralize your teeth. So first tool, there's mouth rinses. The idea behind that is you can kill some of the bacteria that are in your mouth. So you can just reduce the amount of bacteria you have going. And this video that I'm playing, there's no audio, it's just showing bacteria repopulating after a dental cleaning. So if you kill bacteria, you reduce the amount of acid-making bacteria, you reduce the overall amount of acid that's produced in your mouth after you eat something, and you improve your Stefan curve, which was that curve that I had showed you. So mouthwash is a really great tool. Unfortunately, it's something that you have to continue to use and you have to continue to do. Otherwise, these bacteria will just repopulate and reproliferate, which is what's happening in that video. So Listerine is a great mouthwash to use. Because most of you are oil people, I also wanted to include that tea tree oil, a 0.2% mix of melaleuca, is actually found to be a really great antibacterial. It can reduce the amount of strep mutans, which is the initial bacteria which causes tooth decay. It can also reduce gingivitis. And one of the really fascinating benefits I found in this article on clinical microbiology was that those reduction in bacteria levels, it can last for about 2 weeks. Another tool that I wanted to mention is something called oil pulling. I had never heard of oil pulling up until a couple weeks ago, and I decided to investigate for this presentation. Unfortunately, although it seems to be very in vogue and there's lots of blog articles about people who've had these really great benefits, there really aren't a lot of good studies on it. Now, that's not to say that in the future there won't be some studies to show some really fantastic benefits, but I just couldn't find good evidence out there right now. And the only study I could really find that seemed trustworthy was one that was done by a dental hygienist, and she compared sesame oil. By the way, oil pulling, for those of you who don't know, is when you, instead of rinsing with a mouthwash, you rinse with oil in your mouth for about 20 minutes, and then you spit it out. And it's kind of a time-intensive process, it seems like. So the study that I found about oil pulling, she was comparing sesame oil to coconut oil and water. And water was just the base, and then she measured bacterial levels. And she found that sesame oil was 5 times as effective as water. Sesame oil is I can imagine having sesame oil in my mouth for 5 minutes or 20 minutes. So, and coconut oil was twice as effective as rinsing with water. So it doesn't seem like it does harm. It may do a little bit of good, but the jury's still out about how much good that oil pulling does. And also the bad news is that the bacteria began to repopulate after about a day of stopping doing it, whereas with the tea tree oil, it was 2 weeks before the bacteria started to repopulate. Another tool for remineralization is introducing probiotics. So there are actually oral probiotics that are made to introduce good mouth bacteria. However, again, similar to the mouthwash, this is something that you have to keep taking. As a disclosure, I don't have any affiliations or financial affiliations with any of these products that I'm putting up here. These are just some examples of oral probiotics that are out on the market right now. There haven't been fantastic studies out that showed really great efficacy, but the studies that I did see showed that you have to continue to take the oral probiotics. Microbiologists just haven't figured out how you can keep the good bacteria in your mouth and you can get it to stay there. Another way to remineralize is by your diet. So foods that have calcium in it are really fantastic for being able to remineralize your teeth. So cheese, milk, yogurt, and also eating foods that don't have a lot of starches in them or sugar, so popcorn or nuts or fibrous foods. Something else to consider, if you're somebody who's prone to getting cavities, maybe after every time you eat something, rinse your mouth out with water and see, because that can help to reduce the acid levels in your mouth and recover that Stefan curve. Maybe eating dessert first so that you can hit your mouth with that sugar and salt right in the beginning and then give your mouth that time to recover. I recently saw a study in the Academy of General Dentistry's journal, and they compared sugary drinks versus sugary snacks. What was worse? The drinks. The sugary drinks were worse. Now, I understand it's summertime, lemonade is very refreshing. Just drink it all at once. Don't be sipping on it throughout the day. Okay, and then also some other suggestions to decrease the time of your Stefan curve. So avoiding foods that can drop the acid levels in your mouth. And also swishing with baking soda. I found in a preventative dentistry textbook, they actually recommended swishing with baking soda. Baking soda is the opposite of an acid, so it can help to balance out the pH levels in your mouth. Casein phosphopeptide amorphous calcium phosphate. This is a milk-derived protein that becomes bioactive once it's put in your mouth, and it's very good at helping to remineralize your teeth. Some of it is put into gums, and there's even some dentists who use something called MI paste. If they run into a patient who just has these small starting decays all over their mouth, I've actually seen some really impressive results using CPP-ACP in order to remineralize your teeth. And my favorite is xylitol. Xylitol is a sugar alcohol that's derived from birch sap. And unlike other types of sugars where bacteria feed off of it and then they produce acid, xylitol, when bacteria eat it, they can't metabolize it. And they stop eating bacteria and they can't produce acid. So something else to combat demineralization is if you have xylitol mints, if you take them after eating, that can also help to reset your Stefan curve and get you back into a remineralization zone instead of a demineralization zone. The only thing with xylitol is that the studies show that you need about 5 to 6 grams a day of xylitol for this to be effective. And the most effective way that I've seen is to use mint. Some of them are in gums, but you probably won't be getting enough xylitol to benefit from remineralization. Be gentle on your teeth. Use a soft bristle toothbrush. There's no need to be using a hard bristle toothbrush. As I was finding images for remineralizing, I saw a lot of blog posts about making remineralization toothpaste on your own. Now, I don't necessarily have a problem with this. There's been evidence to show that even brushing your teeth without toothpaste, that's beneficial in helping to reduce the bacteria in your mouth. If you want to make something like this, that's fine, but just be careful. Some of these are not dentists who are coming up with these toothpaste ingredients, and some of the ingredients are actually quite abrasive on your teeth, and so you could wear away your enamel that you're trying to remineralize in the first place. So just be careful and proceed with caution. I found that all over the internet, so that's my professional opinion on that. Okay, to recap, tools to remineralize. You want to increase your pH after eating. You do that with water or with baking soda. If you stimulate your saliva, like we talked about in a previous slide, saliva has calcium and phosphates in it, and it can help you to get back into that remineralizing zone. And xylitol, mints, milk, cheese, mouthwash. There's lots of tools that you can use to remineralize your teeth. All right, the last section. This is one of my favorite topics. This is about infant oral health. Now, some of you might be thinking, why on earth is she talking about infant oral health? They don't have teeth. Like, what on earth can you possibly do to help an infant with their oral health? I wanted to use this as a chance just to watch a cute YouTube video of a dad and baby laughing, because babies do lots of things with their mouths that are important, including laughing, but I don't know if we'll be able to hear everything as well as I would have liked to. If you search on YouTube "Babies First LOL," this one will brighten your day. All right. When I was practicing at Hopkins and when I was in dental school, a lot of people would say, Doc, I keep brushing my teeth, and no matter what I do, I floss. I do everything I'm supposed to, and I'm always getting cavities. I don't know what to do. And they were telling the truth. They had very good oral hygiene. So it was bad teeth in the family. This is a picture of my grandparents. You can't really see, but that's my dad, and he's the oldest of 9 kids. And every single one of my aunts and uncles, they all struggle with tooth decay. If they miss a dental appointment or they start to slack on their oral hygiene, they get cavities. Now, this is a picture of me and my family. There's the 5 of us all grown up. We cleaned up well from our sailor hat days. None of us have cavity issues. Like I told you, I've only had 2 in my entire life. How is this possible? What is going on? So the difference is, it may actually surprise you. Bad teeth are not inherited genetically. However, our bacterial populations are passed on to our children. So in all of these pictures, you see moms loving on their babies, but I also see moms passing bacteria and passing their oral bacteria to their babies. You know, this kid, I'm sure, is going to eat his toes right after his mom kisses them. And that's how we pass our oral bacteria onto our kids. And the type of bacteria you have in your mouth will determine if you're prone to getting cavities or not. And if you have that bacteria, and if you have those types of bacteria, you will always need to stay on your dental health. You may even need to add some of these adjuncts, like using xylitol or mouth rinses. Whereas someone like me, where, when I was a kid, if I didn't brush my teeth for a few days, it wasn't a big deal. So the literature shows that the bacterial DNA in babies is the same. You can trace that same bacteria. It comes from mom. It doesn't come from dad. It typically comes from mom or the primary caregiver. And babies' mouths are actually sterile at birth. There's no bacteria in babies' mouths. So what can you do about this? You need to make sure, if you are a mother or you're planning to have kids, you need to take care of your mouth. You need to make sure you can get those bacterial populations in check so that you don't pass on those bad bacteria to your children. All right. Another factor about infant oral health that I'm very passionate about. So what body part are teeth similar to? They're similar to our bones. Exactly. Man, you guys are on it. And how, meaning by what structures? Calcium and phosphates, and that prism structure is called hydroxyapatite. What nutrient helps with calcium absorption in our bodies? Yeah, vitamin D. Vitamin D comes from sunlight, and a huge percentage of the U.S. population is vitamin D deficient. So why would a dentist care about vitamin D uptake? Because our teeth are made up a lot of calcium. And this is a chart showing tooth development. So while a woman is pregnant, that baby's teeth are developing. And the blue represents primary teeth, the yellow represents permanent teeth. Permanent teeth start developing up below their baby's jaw at about 6 months. If your child has a deficiency in vitamin D, the outside surface of the enamel may not be as strong as it could be. Get yourselves checked for vitamin D levels if you're planning on having a baby. Make sure that your vitamin D levels are where they should be. And if you have a child, talk to your pediatrician about vitamin D supplementation. What do you need to be doing, and what are their levels at? All right, lastly, I told you I was going to be starting up a dental practice soon, so I just want to review what my practice focus is going to be on. The name of my practice is, I just got the legal paperwork submitted. It's going to be Infant Dental Center, and I'm going to be focusing on tongue tie and breastfeeding. So this is an anatomical condition called ankylglossia. About 3 to 10% of infants have this condition, and basically, I'm just going to show you a picture instead of trying to describe it. This picture on the bottom, you see, I don't know if you guys can see that band of tissue right there. That limits a baby's ability to move their tongue. And when they can't move their tongue like they should, they're really not able to breastfeed properly. And unfortunately, it can be very painful for the mom, and it can be difficult for the baby because they're not able to get as much breast milk as they could. Something else that's also important with tongue tie is pretty much every case of tongue tie also has some sort of lip tie involvement as well. Babies, in order to have a good latch, they need to be able to flange their lips out so that they're able to get a good latch and be able to breastfeed properly. So I'm just going to educate you all on tongue tie and lip tie. These slides are from Dr. Kotlow. He's the dentist godfather of infant tongue tie and lip tie. And this is what I'm going to be doing in my dental practice. So as you can see on this list, these are some infant factors to consider, some mother factors to consider. It's a very stressful experience for mom and baby. And these are some common myths of ankylglossia. And one myth that I just wanted to address was that surgery must be completed in the operating room under general anesthesia to fix this condition. This is not true. It does not need to be performed in an operating room. And in fact, when I do tongue tie procedures, I do not use injectable anesthetics on babies. This is how you diagnose right after an infant is born. You feel underneath of their tongue. Dr. Kotlow likes to explain it as a speed bump, and also just noticing if you touch like on the infant's lip, are they able to extend their tongue out of their mouth? Are they able to extend their tongue over their lower jaw? And these are some examples of tongue ties. Some of these are very dramatic. You can see the piece of tissue extending all the way to the tip of the tongue. And some of them are not so dramatic. This is called a posterior tongue tie. And that is more diagnosed by the baby's ability to function. If they try to lift their tongue to the roof of their mouth, is there like a cupping shape right here? If they're crying and trying to lift their mouth up, how high up can their tongue go? And you can see that baby's tongue really doesn't extend very high up into their mouth. And this is just explaining what a lip tie is. So it's pretty much just a tongue tie of the lip. And surprisingly, this procedure is not all dramatic as it may seem. The baby is swaddled and placed on the exam table. And this is a before and after of a baby sucking on sugar water. That's actually what's used for young infants for analgesia. Parents who choose to have their children circumcised, a lot of times that is what they use for the analgesia for the babies. So this is a before and after, and with the after you can see how the baby's able to pull that cotton roll back farther into their mouth. This is what the procedure looks like. The before, they use a groove director in order to lift the tongue up, and that's what the incision looks like. It's not very dramatic. It's used. This is a laser procedure, and that's what I will be using to remove some of the tissue. And you do the same thing with a lip tie. And this is a before and after of the baby being able to latch on. You can see in the second picture, the baby's able to have a much better latch, and it's a lot more comfortable for both mother and baby. When my son actually had to have this procedure done at 2 days old, and when I was at Hopkins, I had done a few of these, and as soon as it was diagnosed, I knew we're not messing around with this, we're getting this done immediately, so I'm able to take care of my son like I want to. All right, infant oral health, quick review. Get your vitamin D levels checked. Keep in mind tongue ties for young babies and how that can affect breastfeeding. And also vertical transmission of bacteria. Mom passes their oral bacteria onto their babies. Finally, we're going to talk about oral bacteria and overall health. So, as a hospital dentist, what do you think my most common request was from physicians? When I was here at Hopkins, why was I there? Why did they even care if they had a dentist in that hospital? Abscesses? It wasn't for abscesses. It wasn't for referrals from the ER. It wasn't from car crashes. It wasn't from people who had broken off their teeth. Cardiac patients. That was the primary patient who I saw. Now, what on earth does the heart have to do with teeth? Why would these physicians even care? And they care a lot, because there were quite a few times when somebody's major heart surgery was put off because of their teeth. It turns out that when somebody has a bacterial infection in their teeth and they have a heart valve put in, that bacteria in their mouth can travel and vegetate onto that heart valve and grow. And they can have, those plaques can get thrown off, and they can have a stroke, they can have a heart attack. It is very, very serious. And I tell you this story just to illustrate the point that our mouths and bodies are all interconnected. These bacteria in our mouth can play a role in other parts of our body as well. So I hope I've enlightened you today about the different types of dental diseases, how you can remineralize your teeth, infant oral health, and that you guys feel more empowered to take steps to have good oral health. Thank you.